As Michigan becomes more diverse, local hospitals are working to make sure that all people get quality health care by offering new and different kinds of interpretation technology.
24-Hour News 8's Coco McAvoy sat down with hospital personnel to learn more about how they respond to emergency situations when a patient doesn't speak English.
The healthcare model is changing in that it's more patient-centered.
And that means meeting the needs of all patients, regardless of what language they speak. The Language Services Department at Spectrum Health has been around for 17 years now, with a staff of nationally certified interpreters.
We have 5 languages that we house in staff, and those are the main ones. We have Spanish, American Sign Language, Vietnamese, Arabic, and Chinese Mandarin.
The hospital also uses a phone vendor that can provide 200+ languages. And 2 years ago, Spectrum Health started incorporating these handy devices called mobile interpreting units.
And through this iPad, providers are able to dial a secure phone number that connects them through one of our own staff interpreters.
And the services are used much more than you may think. In fact, the hospital completes more than 90,000 requests each year.
If you look at it this way, when we provide care to our patients and families who come here to Spectrum Health, we want to be able to make sure we provide care that is of high quality and care that is safe. And in order for us to do that, it's very important for us to communicate very effectively.
For providers, it helps bridge the language barrier so they can relay important messages to patients regarding their care.
It's important for us to also be able to meaningfully have conversation with patients and families about diagnosis and treatment options and treatment plans so that they can fully engage as equal partners in their health care.
The reality is to be able to make sure that we can provide care to all our patients, because really that's our mission, to improve the health of the communities that we serve.
In Grand Rapids, I'm Coco McAvoy, 24-Hour News 8.
Well, Spectrum Health says it plans to start using the mobile interpreting units at the Helen DeVos Children's Hospital within the next few months.
Spectrum Health isn't the only local hospital facing a growing demand for interpretation services. Mercy Health St. Mary's has had their interpretation services department for 15 years now. Hospital officials say the main languages they serve are Spanish, Bosnian, Vietnamese, Somali, Nepali, and Burmese. St. Mary's has a phone interpretation system that covers more than 200 languages and has been used on a daily basis for the past 9 years.
Healthcare in the United States is so interactive, and the patient is definitely in the driver's seat. And in order for them to be successful in their care of their general health, it is important that they learn that the system works for them.
St. Mary's says they also use the phone interpretation service in emergency situations.